Hello and welcome to the channel. My name is Patrick Dahlin and today we're going to look at BCAA, branched chain amino acids, and their potential effects of your brain neurochemistry. And BCAA, you might think, well, I'm not on any bodybuilding supplements, so I don't have to worry about it. But they are in fact often added to, for example, energy drinks, and those sometimes kids are even drinking. And is that so wise? Is that something to worry about? Well, if this is a topic that are of interest for you, close to your heart, then I would suggest that you stay until the end. And if you like this and other videos, like, subscribe, share, comment, all those things, thank you. So BCAA are in more things than just supplements for bodybuilding, even though that is where they originally were used. They do quite frequently also occur in energy drinks. And why they are there is because they potentially could help you build more muscle, even though that has been shown to be the opposite. They could potentially help you to feel less tired. There's probably some truth to that. Could potentially help you in long distance races, endurance races, with mental tiredness, mental fatigue. Which might be something to that. They are also used as a fuel in long distance events. And leucine, for example, is a ketogenic amino acids, meaning it takes the ketogenic pathway. There might be some slight benefits to that. So that is the reason provider in there to push for some health or some performance enhancement. But taking these standalone have some implications, because if we look at leucine, it's taken up in the cell by the same transporter that also take up phenylalanine and also tryptophan. And tryptophan is converted by 5-HTP, which also, by the way, is a supplement, to serotonin. And modulation of serotonin are also quite common in the pharmaceutical world about antidepressant and anti-whatever kind of psychiatric modality you might be suffering from. So taking leucine will have actually the opposite effect on the brain neurochemistry as, for example, an SSRI, selective serotonin reuptake inhibitors, because they increase the amount of serotonin in the brain, which may have an effect on some type of psychotic conditions. So this one will do the opposite and decrease the amount of serotonin, and also will decrease the amount of phenylalanine uptake, which goes to tyrosine, which go to dopamine, which also goes downstream to some other flight and fight hormones. Because most things in the body is very connected. If you do something here, it will get downstream consequences. Now, unfortunately, there aren't really any studies on humans, because you wouldn't get them approved, and also it's very difficult to analyze what happens inside the brain. But we know on cell culture what's happened, and we know, for example, mice studied what happens. You can see behavior changes in mice that do take BCAA, and you can measure that they have depletion of serotonin and dopamine in their brain, which makes them anxious and behave in strange ways. So it's not impossible at all to imagine that this could also happen in the human brain. So just as playing around with pharmaceutical drugs that alter brain neurochemistry is not wise unless a healthcare provider prescribes it to you, it's probably not wise to play around with these things either, because they have similar effects on your brain neurochemistry. And many mental disorders seems to be associated with higher or lower or some kind of disruption in brain neurochemistry, which also is often related to GABA and glutamine, serotonin and tryptophan, or dopamine, L-dopa, and phenylalanine tyrosine. Those are the main three that you can see they are somehow off. One way or the other, they're tilted in most psychiatric disorders you see. That does not necessarily mean that they always are the cause, but they could sometimes be the cause. They could sometimes be partial causes also. So there is a risk, in my mind at least, to take BCAA standalone, and in particular to have kids drinking those energy drinks. And this is, if you're normal and take something, alter things, the risk is it becomes worse. But what happens if you already have some kind of diagnosis? Will then taking BCAA, for example, be totally devastating? Or will it help? Because if you are off in one way or another, maybe BCAA helps to get things normal. And it actually does that for some type of brain, as I said, disorder, sound various, but all these letter combinations, some kind of psychiatric letter combination. It sounds very severe because psychiatric diseases range from just normal people that the psychiatrist, therapist thinks have whatever letter thing, to very severe malfunction of the normal human being. So they range quite a lot. So it is so that BCAA could make things worse or better depending on if you have some kind of imbalances in the brain, depending on in which direction that imbalance is. If it's in one direction, it will make it worse because you already are too much to the left and go more to the left. If you are on the other side, it might actually push it down to the normal. There are, for example, a very recent study done on this in humans also, not just rat this time, because that this is the case has been known for quite some time, but it's not so often you see them going out and trying those things in humans. And on autism, for example, a study was done, and quite many of the people in the study experienced improvements in their symptoms when taking BCAA. Now, this I'm saying you is not medical advice. You can only get that from a professional healthcare provider local to you, but as education purposes, and also for medical professional healthcare providers who I suspect don't sit and read biochemistry book all day long. They're pretty busy with treating patients. But this could be something for you to look into. You have this reference of a study here in case it's something you want to consider to try out on some of your patients. So to conclude, BCAA on alone, taken alone, because they are in all kind of proteins, but then they come with other amino acids in the good balance, so you don't change your balance in the brain or in the muscles. But when you take amino acids in general alone, you're shifting that balance probably, and does that have any implications or not? And those implications, are there something I'm striving for or something I want to avoid? That is how these games work. And if you have normal brain biochemistry, they risk to tilt them to something more abnormal, which you probably don't want. If you are on the edge one way direction either, they can even make it worse on the edge or potentially even go from one edge to normal. You don't know that without looking into your specific disorder and the specific brain chemistry, neurotransmitters of that disorder, which you probably shouldn't do alone, but you can bring it up with your healthcare provider to consult them about it. Yes, so I hope this brought some light to something I rarely see anyone discuss or talk about. And if you like it, please subscribe, please ask questions, and if you have comments, just feel comments. I like good or bad comments actually. So happy to get comments. Thank you for tuning in today, and hope to see you soon again. I will bring out more things on the topic of supplements also, as well as other topics. But right now I'm a little bit into supplement topics for a couple of weeks here. So thank you and see you soon again.